Thank you very much. Thank you, Secretary of State. So first of all, the government promised a workforce plan, delayed to the spring, it's now the summer. When's it coming out?
It should be published shortly, I will say, in government speak. I know that's an irritating answer, but
Is that before the recess or not?
We just need to get agreement for when we can publish it. I think the work is largely done.
Presumably you know whether you're going to publish it before the recess or not.
I can't confirm a date.
Well, no, but you can confirm whether it's coming out before the recess or not.
We have to get clearance across government. As you know, there is various cabinet office guidance.
If I'm to take it, if you haven't got clearance yet, it's not going to come out before the end of the recess.
Sam, can I?
Yeah, absolutely. As you will be aware, any potential change from a political perspective, we are required to ensure that any decisions that are taken in the future are taken in that context. So the Secretary of State's been, it is actually a permanent secretary and a cabinet office responsibility to determine and advise when things from a significant strategic perspective are published. And what that means is I cannot give you a guarantee that it will be published before recess, but as the Secretary of State said, absolutely as quickly as possible to make sure that we publish it.
Doesn't sound like as quickly as possible. It sounds like another delay, but okay. Patient Safety Commissioner Henrietta Hughes wrote to Number 10 to ask what discussions government's having on the redress scheme for victims of sodium valproate and pelvic mesh. We've had 2 years, still no response to the Hughes report. When's that happening?
I'll firstly start by saying I know this is a very difficult and complex issue, and it's one that I've had some briefings on from the department, and I can understand the frustration of people who want to see a response in public. It is a complicated one, a complex issue that I think it's important we get right. So
when are you going to respond to the review?
I can't give you a date today.
Okay, I'll try again. So will it be, presumably it's not going to be before the recess? Is it going to come this calendar year?
As I say, I can't give you a date.
It's really difficult, Secretary of State, for me to understand what you're working at pace. It's going to come soon. It's shortly. This isn't very helpful for us on the committee. You must understand that those people, as you've rightly pointed out, who have been affected by sodium valproate and mesh, have an expectation, a correct expectation, that this government should respond and give them the redress that they deserve. And it sounds like you're prevaricating.
No, I wouldn't want people to feel that. I would want people to know that I can easily imagine how frustrated they must feel and how they must want to have a response out in public. I can totally understand.
So what's holding it up? What's holding it up?
The complexity of the issue and getting the response right, because I think it would not be fair or not be right for me to rush getting something out in public that ultimately is not the right place to be and is not the right solution. I think that anything we say or publish on this, we need to get in the right place that the government can stand behind. And
the problem, Secretary of State, of not being able to even put a ballpark date on this is that it gives no confidence to those victims that they're going to get any compensation at any point soon. So you're not going to give me an answer, but I would press you to really think what impact this delay is having on those people, because I think it's a real problem.
I take that very seriously, and one of the things about being in this role as Secretary of State for Health is that every day and every decision I'm thinking about how the people who will be affected by that decision must be feeling as a result of a decision being taken or not being taken, or what decision we take. So it's very live in my mind. But as I say, it is important we get this right. It is complex. I can understand the frustration that people may well be feeling, but I don't think it's right for me to make commitments I can't stand behind.
Okay, well, I'll try on another commitment then. Your predecessor made a very clear commitment to roll out access to fracture liaison services in every area by 2030. Is that still the government's commitment?
We're still committed to that, and we are focused as well on investing in new scanners. There's a lot of capital investment going into DEXA scanners at the moment, which can have a huge benefit identifying potential fractures early as well, and giving people a good overview of what's happening in that regard. But yes, we're still...
Will you publish whatever implementation plans you have for that, so that this committee can scrutinise whether you're likely to hit that 2030 deadline?
I'm happy to discuss with Jim and Sam, and then we can write to you with an update.
Thank you very much. Okay, moving on. You'll be aware that in March, 351,000 people were removed from NHS waiting lists. What due diligence has the department done to ensure that those people were genuinely people who did not need to be on those waiting lists?
I might ask Jim to come in on some of the detail, but just to say, more generally, because I think it's an important point to give people reassurance and confidence in the system, that the vast majority, I think over 85% of the reduction in waiting lists that we've seen in recent months, in recent years, and under this government, has been because of people having care, people having direct care that they need. So there's people coming off the waiting list because they're getting care from the NHS. But in terms of the actual process, Jim, is that okay if I bring you in?
Yeah, absolutely. So assurance on the challenge, first of all, with previous Secretary of State and James, because a lot of this sort of overlapped both periods. We've been through lots of processes of supplying data, challenging the data, understanding the underlying removal rates, the reasons for the unreported removals, making sure that people haven't been removed in an undue fashion who still needed care and treatment. So that's been an ongoing process for the last several months. In aggregate terms, we still, in spite of the year-end position, we were still below pre-COVID levels of validation. So this generally gets labelled as validation, but it's generally a post-period event, which could mean there's been a clinic somewhere else, but the data hasn't been fed into the main system in time. Some of it is validation, but we ended up below COVID, before COVID levels of normal validation, and we know there's still an awful lot of tidying up still to be done. So we've been challenged by James, by Wes previously, other colleagues in the service, media rightly, to be clear that every organisation should have an assurance system on all this to make sure they're scrutinising removals appropriately, that people aren't being lost, aren't being removed unnecessarily. There are processes involved so that patients are actively involved and clinicians are actively involved in those processes, and we test it all the time.
Okay, so sorry, thank you, that was helpful, Jim. Back to your Secretary of State. Are you confident by that? Are you confident in that answer?
Yes.
Okay, thank you. Okay, moving very briefly on to my last set of questions. You've had a sort of a transition yourself, Secretary of State, from believing a woman could have a penis to rightly believing that a woman can't have a penis. I'm very concerned about people who detransition or desist from their trans identity. It's clearly a very marginalised group. The CAS review was clear. Recommendation 25 called for a dedicated follow-up and support for people who detransition. Yet 2 years later, there's no nationally commissioned NHS detransition pathway. Why is that recommendation not being implemented?
Well, let me just firstly say that Dr. Cass's work, I think, certainly until recently, had cross-party support, and I think in an issue that attracts a lot of strong feeling, having Dr. Cass.
I'm really sorry, Secretary, I've only got 2 minutes. I'd really like you to answer my question.
In terms of the specific recommendations, I can write to you with that detail, unless Sam or Jim has that to hand, but I can write to you with that information.
Well, see, I've been speaking to one detransitioner who is 23 years old, has autism, has complex needs, his key worker has to go everywhere with him. Despite those medical needs, he underwent major surgery on the NHS, had his genitals removed in order to affirm a trans identity, despite failing half of the capacity tests that were supposed to stop this. So I'm really troubled that there seems to be no data being held about people who desist or detransition, and the planned data linkage survey, which would have helped with that, isn't going forward. So how can you, as Secretary of State and the government more widely, claim to be pursuing an evidence-based policy when you're failing to collect really essential pieces of evidence, especially around detransitioners?
I fully expect all parts of the NHS to comply with the data linkage study and to make sure the information is available for that. It will provide different type of evidence than we'll get from the puberty blockers trial, which I know has been the subject of discussion in the Commons recently. But the data linkage study is a really important part of the evidence, and I fully expect all parts of the NHS to comply with making sure that information is made available.
Can I just say as well, you said a couple of things in that last couple of sentences that implied a lack of compliance with clinical process, decision-making process. So if you're able to share with us the direct details, if that's possible with their agreement.
I'll have to speak to them and then let you know.
Absolutely, but I'm happy to test that and make sure it's being complied with appropriately.